Well, we take for granted the food we buy, and we take for granted that it's safe, which makes the fact that one person has died and more than 60 have been sickened in multiple provinces makes it rather concerning, right? Recalls were issued for certain cantaloupes, and now both U.S. and Canadian healthcare officials are investigating. CTV's Genevieve Beauchemin is looking into this for us.
A healthy staple of fruit salad, cantaloupes are now linked to illness, to a fast-growing outbreak of Salmonella. The Public Health Agency of Canada recorded at least 12 cases in British Columbia, 12 in Ontario, 35 in Quebec, 2 in Prince Edward Island and 2 in Newfoundland and Labrador. Of those, 17 were ill enough to require hospitalization and 1 person died.
She was definitely having diarrhea. She was vomiting. She wasn't eating very much.
Tony Wilcox's 86-year-old mother, Marilyn, is in hospital, likely infected after eating cantaloupe, a fruit she normally eats almost every day. She's responding well to antibiotics, though.
She's feeling so much better, too. You can really see the color in her face. And she wants to return to bingo and all the activities and the games that they do at long-term care homes.
Experts say the rinds of the fruits are likely contaminated at the farm by soil or irrigation water.
Once you make a cut and you push the salmonella from the rind down into the tissue, salmonella grows very well in that tissue.
To prevent other cases, some cantaloupes are being pulled off the shelves. The Canadian Food Inspection Agency issued recalls of 2 brands, Malachita and Rudy cantaloupes, sold in at least 9 provinces, but possibly across the country. There are secondary recalls of other foods like fruit salads or trays. Experts recommend throwing out the fruit from these brands, but also any you're not sure about.
We are seeing cantaloupe outbreaks become more common, so we do need more education for processors about best practices for keeping salmonella out of their fields.
And the recommendation from food safety experts is to always scrub cantaloupes carefully with soap and water before cutting into it, but also not to buy any that is pierced or bruised. Sandy.
All right, Genevieve, thank you. That is good advice. Joining us now from Hamilton, Ontario is Brian Coombs, chair of the Department of Biochemistry and Biomedical Sciences at McMaster University. Brian, I know that you and your team have studied Salmonella extensively. The question is, how concerned should Canadians be about this outbreak?
I think anytime you have a foodborne outbreak, especially with Salmonella, there's definitely cause for concern. Salmonella can cause very wide-ranging symptoms from quite mild to actually quite severe that requires hospitalization. And in this particular outbreak linked to fruit products in Canada, there's already been 1 death and multiple hospitalizations. So I think concern is warranted.
Now, the fact that it's also in the United States as well, are you concerned that this is likely to expand, and how much could it theoretically expand?
I think it's definitely possible that we're going to see the case count rise simply because of the time lag between sample collection in hospital and diagnostic microbiology workups and reporting. So I think, the reporting will always lag behind the cases a little bit. And so I think we're probably, we're not out of it yet. I think we're going to start to see, more cases as the next few days wears on. Because the Public Health Agency of Canada has gotten in front of this and made some important announcements to the Canadian public about food recalls. Hopefully that will do the trick and do what it's intended to do, which is to make people more aware of what they shouldn't eat and what they should throw out if they've potentially purchased it already. So hopefully it will not be a very long-lived outbreak, but I think the case count will rise a little bit.
Okay. Brian Coombs, thank you so much for this. Well, if a spoonful of sugar does indeed help the medicine go down, there are going to be some unhappy kids and frustrated bakers out there today. A walkout by workers at a BC sugar refinery is behind a shortage of the white stuff in Western Canada. CTV's Manitoba Bureau Chief Jill Makashon taps into her sweet tooth. Jill, what impact is the strike having?
Sandy, some grocers are rationing sugar to 2 bags per customer in Winnipeg today, as the bitter reality of the shortage continues.